Coronavirus cases in the U.S. are spiking, and Mike Pence is ignoring his own task force's rules. Check this out. Pence deleting this tweet. You can see him at a Trump campaign field office in Arlington, Virginia. No one wearing a mask. No one social distancing. But the leader of the now hidden coronavirus task force has some work to do. Cases are growing in the U.S. as they declined elsewhere. Yahoo News reporting a 36% rise in recent days, the biggest spike of the top 10 countries in total cases. In Arizona, cases have nearly doubled in the last 2 weeks, with officials warning hospitals could be at full capacity next month. Since Memorial Day, hospitalizations are on the rise in 9 states. And today, Treasury Secretary Steve Mnuchin said, "We are not shutting down again."
We can't shut down the economy again. I think we've learned that if you shut down the economy, you're going to create more damage, and not just economic damage, but there are other areas, and we've talked about this, of medical problems and everything else that get put on hold.
All right, joining me now is Dr. Natalie Azar, a rheumatologist with NYU Langone Hospital and an NBC News medical contributor. Dr. Azar, great to have you with us this evening. Let me put that Pence photo up for you and our viewers to look at again. And, you know, from your medical expertise, break it down for us. What is wrong with this picture?
Yeah, Eamon, thanks. Yeah, you said it really with the picture is worth 1,000 words. I found this to be incredibly surprising, irresponsible, disrespectful, frankly, to all of us who are doing our part. It's such a small gesture that really goes quite far. In fact, I'm going to punctuate that my commentary with a new report that was just released today from the National Academy of Sciences that actually looked at, in Wuhan, Italy, and New York City, trends and analyzed different pathways of transmission and different mitigation strategies. And basically, they concluded that this airborne transmission is really the predominant route of transmission. And again, we've been talking about this for some time, but they basically looked at pre-mandated mask wearing to post-mandated, or before, I should say, we were mandated to wear masks, and then after that. And they found that dozens, thousands of cases could have been prevented in both Italy and New York City. So this, again, you know, I'm just disappointed. I think there needs to be consistent messaging from leadership, and that they need to model appropriate behavior so that we all understand that this is what we need to do. I'm
not going to say it was excusable for someone who was not the head of the coronavirus task force. It is shocking that it was from the head of the coronavirus task force, who should know better. Let me ask you this, though. The Trump campaign asking people to sign a waiver. We showed it off at the top of the hour before attending this month's, quote, MAGA rally, saying they won't hold the Trump presidency, or campaign, I should say, liable if, in fact, they do get the coronavirus. How much risk is there in attending large crowd events right now? I believe the venue where they're going to be at can hold up to 19,000 people, and anyone who attends has to sign that waiver.
Right. Yeah. Eamon, large gatherings are considered super spreading events. They just simply are, especially if they're in an enclosed arena. We know that being outdoors can dilute and dissipate the virus a little bit. But I mean, listen, the gathering, the people need to be wearing masks. That is an absolute must. You know, I don't know what in their heads is going on necessarily, the people who are going to attend that. If they believe, like the president has been preaching that the virus and the pandemic is not such a big deal, I think they believe that. I truly do. But I would be very, very concerned. And I think that everyone should get tested after they attend a rally of that nature to see if they are, in fact, positive. You can't maintain social distancing in a rally like that.
Let me get your thoughts on Dr. Fauci for a moment, because Democrats are demanding a meeting with him. Listen to Senator Schumer talk about that.
So today, I'm requesting that Dr. Fauci and Dr. Birx and other members of the administration's coronavirus task force conduct a briefing for Democratic senators on the recent spikes.
I can imagine that the White House does not want Dr. Fauci to be front and center at any public event in this country, certainly a hearing on Capitol Hill that would once again try and put the attention back on coronavirus. What are the questions you think he would be asked that we would want to know at this stage?
So I think, Eamon, what we would want to know is that the states that are starting to see spikes, were they fulfilling all those gating criteria? So were they ready to go to phase 1? Were they ready to go to phase 2? Did they satisfy all of that? In terms of the number of cases in and of themselves is not as informative because, again, some of these might be from increased testing. But what is the number actually? Is it reflective of hospitalizations, ICU admissions, and particularly death? And I also want to know how strong the effort was to implement the social distancing or maintain those recommendations for social distancing and mask wearing. Because if all of these spikes are coming from, this social distancing fatigue and people getting very lax, which I understand on the one hand, then, that is something that you wouldn't want history to repeat itself the next time they go into a reopening, if in fact they need to backtrack. So I think those are just some of the questions that they probably will want to ask and we'll really need to analyze.
We'll wait and see if that does in fact happen. Dr. Natalie Azar, always a pleasure. Thank you very much.
Hey, I'm Ari Melber from MSNBC. You can see more of our videos right here, or better yet, subscribe to our YouTube channel below. You could have been anywhere in the world, but you're here with us, and we appreciate that.